On November 17, 2019, a 55-year-old individual from Hubei, China fell sick and suffered severe respiratory distress. In a blink of an eye, this turned into a domino effect pandemic that paralyzed the world. Until this documentary, the COVID-19 pandemic has resulted in over 127 million confirmed cases and over 2.8 million deaths globally. Social distancing, self-isolation, and travel restrictions have led to a reduced workforce across all economic sectors. Coronaviruses are a large family of viruses, some of which infect humans. At their core, they contain a genetic blueprint called RNA. The single-stranded RNA acts as a molecular message that enables production of proteins needed for other elements in the virus. Medical experts have observed that people suffering from COVID-19 usually experience cough, fever, shortness of breath, and sore throat. Severe headache, fatigue, body aches, nausea, diarrhea, and vomiting were also reported. In rare cases, usually a percentage of 2, COVID-19 can lead to severe respiratory problems, kidney failure, or death. Some people who are hospitalized for COVID-19 have also had dangerous blood clots in their legs, lungs, and even their arteries. SARS-CoV-2 is a virus mainly spreads from person to person. Most of the time it spreads when a sick person coughs or sneezes. If you breathe them in or swallow them, the virus can get into your body. Some people who have the virus don't have symptoms, but they can still spread the virus. You can also get the virus from touching a surface or object the virus is on, then touching your mouth, nose, or possibly your eyes. Most viruses can live for several hours on the surface that they land on. That's why it is important to disinfect surfaces to get rid of the virus. Early research has estimated that one person who has it can spread it to between 2 and 3.5 others. The CDC reports there is evidence it can be transmitted if you get within 6 feet of someone who is infectious for a total of 15 minutes throughout a day. Since the start of the pandemic, the scientists were met with various challenges. Because this was a novel disease, all the guidelines were new and experimental. Luckily, the CDC and WHO reached a worldwide consensus on means of prevention. One of these measures is keeping a hand sanitizer with you at all times. COVID-19 and other diseases are killed by the amount of ethanol in it. Since the main transmission mode is through touch, keeping your hands germ-free will constrain the virus. Social distancing couldn't be stressed on enough. People should keep a distance of 6 feet from each other, and obviously physical contact should be avoided. Last but not least, wearing a mask that covers the nose and mouth will majorly limit its transmission. When 2 people wear a mask, the risk of spreading will be reduced to only 1%. There is no specific treatment for COVID-19. People who get a mild case need care to ease their symptoms like rest, fluids, and fever control. Physicians advise taking over-the-counter medicine for a sore throat, body aches, and fever. Such medications include Panadol to be administered as needed. Some studies supported taking vitamins such as zinc, vitamin C, and D. It is not clear whether they truly help with the disease, but some evidence proves that they increase the patient's immunity. In addition to that, many reports advocate the idea of taking baby aspirin since it proves that it decreases the chances of blood clots due to COVID. Antibiotics won't help because they treat bacteria, not viruses. If you hear about people with COVID-19 getting antibiotics, it's for an infection that came along with the virus. Examples of such are azithromycin. The antiviral medication called remdesivir is the first medication to get FDA approval for treatment of patients hospitalized with COVID-19. The FDA is also allowing clinical trials and hospital use of blood plasma from people who've had COVID-19 and recovered to help others build immunity. Currently, evidence of its effectiveness is still limited. Early in the pandemic, the anti-malarial drugs hydroxychloroquine and chloroquine were considered as possible treatments. The FDA later stopped its emergency use order because studies found that the drugs were ineffective and the risks outweigh the benefits. Rounding up, this novel virus posed a major challenge to science and shocked countries globally. Everything now is experimental and in trial and error mode, awaiting further assurance and documentation. Meanwhile, and until an effective cure is developed, people should adjust their lives to this pandemic and adhere to the protective ways to prevent this virus.